Well, I'm Dr. Michalski, Jack Michalski, and I'm the founder of Michalski Orthopedic Center. We've been here in Martins Ferry, Ohio, in the Ohio Valley for the past 12 years. I'm a board-certified orthopedic surgeon. I'm also a fellow of the American Academy of Hip and Knee Surgeons. I'm a fellow of the American Orthopedic Foot and Ankle Society. Also a member of Arthroscopy Association of North America, which is the gold standard of arthroscopic care in all of North America. It's an international organization that recognizes folks through a rather arduous application process. So I'm proud to say I'm a member of the Arthroscopy Association as well. Orthopedic surgery is a specialty that deals with bones, muscles, tendons, joints, ligaments, nerves, and how they all interact and function together. Our goal is to have them function as best as possible. Our focus on wellness, our focus on proper function is key. As an orthopedic surgeon, the specialties I work with are joint replacement, joint reconstruction, knee replacement, hip replacement, shoulder replacement. We also do a fair amount of sports medicine and sports surgery. The medicine being the non-surgical point of it, and the sports surgery being obviously the surgical point. From a surgical viewpoint, we focus on the minimally invasive and the less invasive procedures, such as arthroscopic, mini open procedures for the knee, ankle, shoulder, foot, wrist, elbow. Pretty much everything from the shoulder to the fingertips, as well as from the hips on down to the toes. I just happen to be the #1 surgeon in the United States as far as performance of the 30-year knee. The 30-year knee is a specific type of excellent high-tech knee replacement which, based on an MRI study and a long weight-bearing film, including the joint above the hip and the joint below the ankle, the engineers and I come up with a template that we use for the surgery. Proud to say that I'm the #1 direct anterior hip surgeon in the tri-state area of Ohio, Pennsylvania, and West Virginia. Again, as we mentioned, the direct anterior hip is truly beneficial for the patient. It's muscle sparing, it's joint sparing, and it's pain sparing as well. From an arthritis point of view, there are a lot of joint preservation things we can do. People say, gee, I don't want to go see the orthopedic surgeon, he just wants to cut right away at me. Anything but the truth. Our goal is to try to stay in joint preservation mode as long as we can. When the individual says, uncle, that's when we start talking about the surgical point of view.
The laser treatment that we started here, it's very exciting. We're the first people here in the Valley, actually within the tri-state area, to actually have a laser of this type. It's called an MLS laser. That stands for a multi-lock system. The reason they give it this name is because there are several different beams of laser. There are 2 wavelengths because they treat 2 different things. The pulsed beam treats the pain, and the continuous beam treats edema and inflammation. And when you're covering both of those problems at the same time, it makes for a very short treatment and also a very effective treatment that gives the patient relief very quickly.
Love to have everyone come visit us in the office if you have any orthopedic issues. Again, we work on a referral basis. We'd love to have you get a referral from your primary care doc. He or she can get that to the office. As a specialist, we work on a referral basis. And once we get you to the office, we'll be able to help listen to your questions, hopefully solve some of the issues and approach those issues that you may have. And if we can do things conservatively, great. We can do them with exercise, rest, anti-inflammatories, the supplements, the omega-3, possibly laser treatments, non-invasive for that, different injections we can do, possibly the surgical end of things. So we have the full continuum of orthopedic treatment here for you.